Good afternoon, everyone. Please join all of you soon. Very quickly. Join quickly. Please join quickly so that we can start. Nice. 15 students are still okay. Okay, so let's start today. So, all of you are welcome to the Anatomy Hub. Today we'll start the anterior compartment of the thigh. Right? So, here we'll cover the muscles of anterior compartment of the thigh and the whatever the topographic anatomy is there, that also will cover. Means will cover the femoral triangle also along with the front of the thigh. And whatever doubt you have, please, the super chat is on. Okay, you can chat with me with here. Okay, during the lecture class. We'll see the anterior compartment. Okay, so for the anterior compartment of the thigh, we have to draw the of thigh. We have to draw first the diagram, otherwise it will be unclear, right? Okay, see here you will find the head of the femur. No, then you will find the neck of the femur. Okay, then you will find the greater trochanter of the femur. Okay, and from here you're starting of your shaft of the femur, right? So as you can see here, this is the neck region. Then you'll find the lesser trochanter over here. Then you'll find there is the shaft, right? So this shaft, that is actually anteriorly, it is curved anteriorly. No, if you will see the real bone of femur, you will see that anteriorly it is convex. Okay, and posteriorly it is concave. It is not a straight bone. Okay, it is just curved anteriorly. Okay, so when it will come down, 1 minute, it becomes more larger. Okay, so when it comes downward, okay, and something medially, what will find here? Here will find the condyle. Okay, so this side will find the medial condyle. Okay, and here you will find the, and here you will find the lateral condyle and the shaft that continues above. Okay, so little bit like this. Okay, so this is the femur over here, right? So at this point you will find there is the presence of a line, no? So this line represents from the greater trochanter to lesser trochanter. This line is known as your intertrochanteric line. Okay, what is that line? Intertrochanteric line. So what we'll find over here, here you'll find first the vastus medialis muscle will come from the deep to the superficial. Okay, so the vastus medialis muscle, for that I will use a color that just posterior to the shaft of the femur. This is the anterior view. At the posterior side you will find there is the linea aspera. Okay, the posterior border of the femur, that will be known as your linea aspera. Just I am drawing in a very dotted line. Okay, so this linea aspera, when it comes downward, I am drawing it anteriorly, but you consider it is posterior, right? That's why I am drawing in dotted line. So when it comes downward, it is just divides into two lines over here, no? So these two lines, they are known as your supracondylar ridge. Okay, what is that known as? Known as your supracondylar ridge or line. Okay, so supracondylar ridge or line, how it forms? By the linea aspera. What is this linea aspera? This is nothing but the posterior border. Okay, so here what will happen, from the linea aspera, okay, you will find the, and from the medial intermuscular septum. Okay, septa is nothing but the extension of your deep fascia. Okay, so the medial lip of the linea aspera, and from the septum, medial intermuscular septum, one muscle that starts. Okay, and that is just coming in this way. Okay, so this muscle is known as your vastus medialis muscle. Okay, so this is your vastus medialis muscle. Okay, vastus medialis, right? What is the origin? Origin is from the medial lip of linea aspera. Okay, and from the medial septum. Okay, that septa or medial septa, that is nothing but the extension of the deep fascia, right? Then here it goes downward. Okay, just you leave over here. I will come to the insertion later on. Okay, so here mainly it is going downward and it merges with the other muscles. Okay, what are the other muscles? They are the quadriceps muscles. Quadriceps. So quadri means what? Four. CEPS. Ceps means head. Four-headed muscle. No. How the heads are there? Just we will discuss. Okay. So this quadriceps muscle is the vastus medialis. Okay, and we have the vastus lateralis. Okay, and we have the vastus intermedialis. Okay, then we have the rectus femoris. Okay, so these four muscles, they comprise of your, what is that? Quadriceps muscles, right? So we have learned about the vastus medialis. Okay, then you will find the vastus lateralis muscle. Okay, so the vastus lateralis muscle actually that arises from the lateral septum of your intramuscular septa. Okay, along with that it also arises from the, here you can see, this is the lateral region. Okay, lateral part of your intertrochanteric line. Okay, so it arises from here, and it arises from the lateral lip of your linea aspera also. Okay, it arises from lateral lip of the linea aspera. Okay, and also the what is that, the lateralis, vastus lateralis, that also arises from the gluteal tuberosity. Okay, but it is very less, little fiber that is attached to the gluteal tuberosity, but major part that is arising from the lateral aspect of your, what is that, intertrochanteric line, and from the lateral lip of your linea aspera, and from the lateral intramuscular septa. Okay, and that is also coming downward. Okay, and overlapping to this vastus medialis muscle. Okay, this is the vastus medialis muscle. Fine. So here you will find another muscle, right? That muscle is the vastus intermedialis muscle. Okay, so for that, just I will give another color to vastus medialis, sorry, intermedialis. Okay, or intermedius you can say. Both the terms are same. So the vastus intermedius, that actually arises from the anterior and the lateral surface of your anterior. Okay, and lateral surface of the femur. Okay, so the anterior surface, that is about this thing. Okay, and the lateral surface I am not drawing because that is overlapped by the vastus lateralis muscle, and it is anterior, inferior anterior part, that is also overlapped by the vastus medialis muscle. So only this portion it is visible after you will put the vastus medialis and vastus lateralis, right? Now here what we'll find, these three muscles. Okay, along with another muscle, that muscle is actually coming from the ASIS. Okay, sorry, AIIS. Okay, what is AIS? That is your anterior inferior iliac spine. Okay, so you'll find the rectus femoris muscle. Actually this rectus femoris muscle has two head. Okay, what is that? One is your chief head, and another is your reflected head. Reflected head. Okay, so if we'll see the ASIS is here, then from this ASIS you will find the anterior border. Okay, and here you will find the AIIS, right? Then you will find the, what is that, your acetabulum, right? So the rectus femoris, that actually arises from the AIIS, one head, that head will be the chief head, and another head that is just above to the acetabulum. Okay, here, no, just above to the acetabulum, over the lateral surface of the ilium, here you will find another head. Okay, so this is the reflected head of the reflected head of your rectus femoris muscle, right? So this rectus femoris muscle, just I am drawing over here. So this rectus femoris muscle, that is just coming downward. Okay, this is the chief head, and here you will find the reflected head. Both these heads, they are just coming downward. Okay, and that is also covering to the upper part of this vastus intermedius muscle. Okay, and all these muscles, all these four muscles, they are just coming downward. Okay, and at this point, okay, you will find there is the presence of the patella over here, right? So this is your what? This is the base of the patella. This is your apex of the patella, right? And as you know that at the apex of the patella, okay, here you will find there is the relation of your tibial plateau. They actually makes a tendon over here. Okay, so this tendon just I will draw in another color. Mm, okay, so it makes the tendon over here, right? So this is the tendon of your vastus muscles. Okay, vasti muscle you can say, no, because plural is the vasti, right? So the vasti muscles along with the rectus femoris muscle. So this muscle tendon that will be attached to here, to the base of the patella. Okay, so this is the quadriceps tendon. This tendon is known as your quadriceps tendon. Okay, so this quadriceps tendon, it attached to the base of the patella. But here you have to note one thing. What is that? This quadriceps tendon, okay, that actually when it runs downward, right, it is just covers to the patella, right? Here you can see the patella, it covers to that. Okay, and to the anterior surface of the patella also. Okay, then it runs downward. Okay, so here what we'll find, uh, at the two edges of the patella, the presence of the tendon, okay, that is known as your retinaculum. Okay, what is that? Medial patellar retinaculum. So this will be known as your medial patellar retinaculum. Retinaculum means what? It is the flattened tendon. Okay, retinaculum. Okay, like that this will be your lateral patellar retinaculum, right? So here again another thing you have to remember, at the medial patellar retinaculum, this is the tendon, no, and this tendon, it is more concerned with the vastus medialis muscle, no. So this is your what? Vastus medialis muscle. Vastus medialis muscle. Okay, so this tendon, vastus medialis tendon, means the medial patellar retinaculum and the quadriceps tendon. Over here you will see that the most part of the quadriceps tendon medially, that is actually what is that? Fleshy in nature. Okay, not like the vastus lateralis and your rectus femoris and vastus intermedius. Okay, at this side you will find there is the fleshy part, means some muscle part that will be overlapped with the quadriceps tendon medially. Okay, that is nothing but the extension of this vastus medialis muscle. Okay, and this muscle, it continues up to this medial border. Okay, so this small muscle, that is nothing but the extension of this vastus medialis muscle, then that runs downward along with the quadriceps tendon. Okay, and this uh, that actually merges with this medial patellar retinaculum, right? That means the medial patellar retinaculum, that is not only the tendon but also you'll find some fleshy parts. Okay, but lateral patellar retinaculum, that is purely tendinous in nature. Okay, now this tendon muscle, okay, this muscle will be known as your vastus medialis obliquus muscle, VMO muscle. Okay, and this VMO muscle is very much important. Who can say what what is the main function of this vastus medialis obliquus? Okay, so this VMO or vastus medialis obliquus, this is actually very important muscles. It is not in anatomy book. Okay, but if you'll see the standard book like Grace and Snails, okay, or Murray, okay, or if you take the standard biomechanics book, you will find the VMO muscle, that is vastus medialis obliquus. Okay, and it mainly acts as a last 15-degree extension. Okay, last 15-degree extension. If you see a surgery case, means if maybe in your what is that, the tibial proximal tibial fracture, or you may find some intercondylar fracture, no, of the femur. At that time you will see that the patient is always leg of the 15-degree extension. Okay, you might have noticed in your clinical practice, right? So this last 15-degree extension of the leg, that actually totally depends upon this vastus medialis obliquus muscle, a very small muscle. Okay, so after this what will happen, here you will find on the tibia anterior surface, you will find a tuberosity over here. Okay, and this tuberosity is known as your tibial tuberosity. Tibial tuberosity. Okay, so this tibial tuberosity, that is the landmark, no, that is actually subcutaneous, and you can palpate that, right? So this quadriceps tendon, when it leaves the patella, okay, here you can see it leaves the patella, okay, at the apex of the patella, okay, and it comes downward and attaches to the, what is that, tibial tuberosity, right? Now what is our definition? What is tendon? Tendon means anything that is the bridge between the muscle and the bone, right? Here this is the structure that attaches from the bone to bone, no, that means from the apex of the patella to the tibial tuberosity. That means we should not call this as a tendon. Okay, bone to bone bridge will be the ligament, right? So this ligament means this will be considered as a ligament, right? This will be considered as a ligament. Which ligament? That is your ligamentum patelli. Sorry, ligamentum patelli. Okay, or patellar ligament. Okay, whatever you can call. So this ligamentum patelli, that is nothing but the extension of your retinaculum along with the quadriceps tendon, when they leaves the apex of the patella, and that joins with the tibial tuberosity. Okay, though they are connecting from the apex of the patella to the tibial tuberosity, okay, that will be known as a ligamentum patelli instead of your quadriceps tendon. Clear? Now here we have seen that the vastus intermedius, vastus lateralis, vastus medialis, and okay, so all these four muscles we have learned about the origin and about the insertion. Okay, all this insertion is your patella, okay, base of the patella, and uh, and at the medial patellar retinaculum, right, in form of your quadriceps tendon, right? So here all these three muscles, what is that, vastus medialis intermedius, that actually crosses only one joint, no, that will be your knee joint. Okay, that means all these three muscles that will be act upon the knee joint only. Okay, so what is that action? That action will be the extension. Okay, extension of the knee. But here you will see what is that, the rectus femoris, that crosses here one joint, that is the hip joint, and here one joint, that is the knee joint. That means this rectus femoris will act, that helps in flexion, okay, and extension of the knee joint, because it crosses the knee joint also. So rectus femoris, it helps in flexion of the it flexes the hip, okay, and it extends the like that. You'll find another muscle. Okay, that muscle is coming from your ASIS. Okay, and so that muscle is known as your sartorius muscle. Okay, what is that muscle? That muscle will be known as your sartorius muscle. Okay, sorry, this one. Okay, sartorius muscle. So the sartorius muscle that starts from the ASIS. Okay, and that comes downward. Okay, and that is the most superficial muscle, and that overlies medially. Okay, that is a strap like ribbon like structure. Okay, that comes downward and medially. Okay, and downward, then downward. Okay, and it aspect of the medial condyle. Okay, at this point it attaches to the medial aspect of the medial condyle. Okay, so this is your sartorius muscle. Crosses here again two joints. No, here is your hip. Okay, that comes downward and medially. Okay, and downward, then downward. Okay, and it attaches to the medial aspect of the medial condyle. Okay, at this point it attaches to the medial aspect of the medial condyle. Okay, so this is your sartorius muscle, right? So this sartorius muscle that actually crosses here again two joints. No, here is your hip joint, so it will act as a again the flexor of the hip joint. Okay, and it also helps in extension of the what is that knee joint. Okay, but in sitting position, when you will contract the sartorius muscle, it will pull. Okay, so what will happen? The lateral rotation, little bit lateral rotation of the leg will be there. Okay, what is that? It helps in flexion of the this one, sartorius. This one is your sartorius. Okay, sartorius. So the sartorius muscle is a strap and long muscle. Okay, that helps in flexion of hip. Okay, extension of knee. Okay, and in sitting position, in high sitting position, right, it helps in lateral rotation of knee. Okay, that's why this muscle will be known as your Taylor's muscle, because when the tailor they are just doing their activities in that tailoring machine, they are using this muscle very frequently. Okay, so that muscle is actually working in a large uh, means okay, so that's why this muscle is also known as your Taylor's muscle. Nice. Now all these muscles, right? Okay, so sartorius muscle, it arises from the anterior superior iliac spine. It what is that? Insertion at the medial aspect of the or medial surface of the tibia, right? And it helps in flexion of the hip. Okay, and also it helps in abduction of the hip. Okay, and it laterally rotates the leg. Okay, and also it extends the leg, right? And it is also innervated by the femoral nerve. Okay, now the artery supplying to all these muscles, that is all the source of the artery is from the femoral artery. Femoral artery. Okay, in form of your lateral femoral circumflex artery. Okay, that is the branch of your femoral artery. And your saphenous artery. your your what is that perforating branches of the deep femoral artery, all these arteries, okay, they are supplying to the anterior compartment, right? Now after this anterior compartment, we'll just see the topographic part of the anterior compartment. Okay, so just I am taking it upward. Any doubt up to now?
No, sir.
No, sir.
Okay. Okay. Now we'll see that uh, here we'll see the lateral border of your thigh. Okay. And here you'll see the medial border of the thigh. Right. So this is the thigh region, anterior part of the thigh. Fine. And at this point you will find there is the ASIS. Okay. Anterior superior iliac spine. Okay. And at this point you will find the pubic tubercle. Okay. And here you will find the ligament. That ligament will be known as your inguinal ligament. Okay. So what is this? This is your inguinal ligament. Which one? This one, no? Okay. And this one is your ASIS. And this is your pubic tubercle. Okay. Now, you know that at this point, you will find there is the body of the symphysis pubis. No, body of the symphysis pubis. So from the body of the symphysis pubis, right, one muscle that is just coming downward and medially. Okay, one muscle is coming downward and medially. Right? What is this muscle? This muscle is your adductor longus muscle, and this muscle will insert at the linea aspera. Okay, linea aspera is the most important landmark because it gives so many muscles attachment. Okay, so this muscle will be your adductor longus muscle. Okay, like that. Here, what you'll find, it is just coming in this way. Right now, from the ASIS, you will find another muscle. No, what is that muscle? That is your sartorius muscle. Right. So the sartorius muscle that is coming downward, okay, and medially, and that overlies it because it is most superficial muscle. No, so it is just overlies to the adductor longus muscle and comes downward and medially. Okay, so this muscle will be your sartorius muscle. Right now, here what we got? We got here. 1 minute, just I will draw. Okay, so here we got that this is the adductor longus. So this is the which margin? The medial margin of the adductor longus muscle. Okay, and here you will find this one will be your what? The medial margin of the sartorius muscle. No, medial margin of the sartorius muscle. Okay, and the medial margin of the adductor longus muscle. Right, and here you will find there is the presence of your ligament. Which ligament? Inguinal ligament. Right, that is from the pubic tubercle to the ASIS. Right, now at this point you will find a triangular depression over here. Okay, so this triangular depression is known as your femoral triangle. Okay, this will be known as your femoral triangle. Okay, so this femoral triangle, that is a triangular shaped depression that is present at the anteromedial aspect of proximal thigh, right? What is that? The femoral triangle that is present at the antero and medial, no? So anteromedial aspect of the proximal thigh, it is distal thigh, so it is the proximal thigh, right? So what you'll find in here, this triangular depression, here you will find it is very much important clinically, because you will find so many what is that, the uh, vessels and nerves, no, they are present inside this femoral triangle. Okay, so during the surgery it is most necessary. Okay, during the um, cadaveric preparation it is most important, right? So what you'll find, this femoral triangle, it has, the triangle means it has the base, no? So the base is your inguinal ligament. Base is your inguinal ligament. Okay, it has the lateral border, right? So the lateral border, that is made up of lateral border, that is comprised of your medial margin of sartorius muscle. Okay, medial margin of sartorius. Okay, and the medial border, that is made up of by the medial border of, what is that, adductor longus muscle. Okay, adductor longus muscle. So it is the base by the inguinal ligament, lateral border by the medial margin of sartorius, medial border by the medial margin of adductor longus, and the apex. Okay, and the apex, that is made up of the meeting point of your sartorius plus adductor longus, right? So this is about your femoral triangle, no? So if you'll find a triangular fossa or triangular area, then it should have the roof, it should have the floor, and inside this box, okay, inside this triangular box, you should keep some structures inside that, no? Otherwise, what is the necessary of this triangle, right? So first we will see the floor of the triangle. Okay, so we got the borders of the femoral triangle. Now we'll see the floor of the inguinal triangle. Okay, so the for the floor, just I will draw in different colors, right? So that it will be easy. I will not use the blue and red and the yellow. I have to use something other color. Okay, just I am taking this color. So here you'll find the pectineal line, no? Okay, so you should know about the landmark of the hip, no? Here you'll find the pubic tubercle. At this point you'll find the pubic crest, or I will draw it. Here is the find the pubic tubercle, here is the pubic crest, and here is your pubic, what is that, symphysis, no, of the one side. And here you'll find the pectineal line, right? Pectineal line that will continue with the arcuate line. Okay, and that will go towards the sacrum to form your pelvic brim. Remember about the pelvic classes, right? So here what you'll find, from this pectineal line you will find some of the muscles. Okay, they are just running downward and medially. Okay, and that is going towards the pectineal line of the femur. Okay, that is inserts at the pectineal line of the femur. Okay, so what is this muscle? This muscle will be known as your pectineus muscle. Okay, pectineus muscle. Like that you will find another muscle. Okay, that muscle I will take in some of the other color maybe in purple I'll take, right? So what I'll find, you know that from the L1, L2, L3, L4, L5, and from the intervertebral disc and from the vertebral body, you'll find there is a muscle that takes origin, okay, and that muscle is known as your what? Psoas major muscle. Okay, this is a psoas major muscle. But you should not forget about another muscle. Okay, that muscle, it is present at the iliac fossa. Okay, what is that muscle? That muscle is your iliacus muscle. No, so the iliacus muscle is there. So the iliacus muscle that is arising from the iliac fossa, and that is just coming downward, okay, and crossing to this deep to the inguinal ligament, okay, it is deep to the inguinal ligament. So this is your iliacus muscle, okay, and this is your mm, which muscle? The psoas major muscle, right? So all these two muscles, right, they will just come downward in form of your iliopsoas muscle, okay, but the psoas tendon, that will be the, what is that, medial to the psoas tendon will be medial to the iliacus tendon, right? So this will be the psoas muscle, okay, psoas tendon over here, okay, and that is going towards the lesser trochanter of the femur, okay, like that. The iliacus muscle, that is also running with the psoas muscle, in both are named as a iliopsoas muscle, no, and they are inserting at the lesser trochanter, right? That means what we got over here? Here we got the psoas muscle, and here we got another muscle, that is your iliacus muscle, okay. That means all these four muscles, what are they? They are your, most laterally you'll find the iliacus muscle, okay, and medial to that you'll find the psoas muscle, medial to that you'll find the pectineus muscle, okay, and medial to that you'll find the adductor longus muscle, right? So see here, the medial margin of the adductor longus, that makes the femoral triangle, but all other part of the adductor longus, that becomes the, what is that, floor of your femoral triangle, okay. So what are the floor of femoral triangle? From lateral to medial, or from medial to lateral, whatever it is. If it is medial to lateral, it is what is that, adductor longus, okay, then the pectineus muscle, then the psoas muscle, then we'll find the iliacus muscle, okay. So this is your, what is that, the floor of your femoral triangle, fine. Now what is over here? This is your what? The inguinal ligament, no, this is your inguinal ligament, okay. So for then we will see the contents of this femoral triangle, okay. What should be the contents? As you know that here you will find there is the presence of your abdominal aorta. So the abdominal aorta, that divides into two as a what? The common iliac artery, okay, common iliac artery. So every common iliac artery, that again divides into the internal iliac artery and the external iliac artery, right? So always remember, the external iliac artery, that runs downward along with the medial margin of your psoas muscle, okay. So here you'll find the external iliac artery, okay. So this external iliac artery, it is just coming downward, okay, and here deep to the mid inguinal ligament, okay, remember, deep to the mid inguinal ligament, it is just continuous downward, okay. So here you'll find the continuation of the, what is that, external iliac artery. Here the name will be changed, okay. So this is your external iliac artery, sorry, the extension of the external iliac artery that will just come downward and medially and goes towards the apex of the femoral triangle. Okay, now this artery will be known as your, what is that? Femoral artery. Okay, this will be known as your femoral artery. Okay, then medial to that, you know that here you will find there is the great saphenous vein. So the great saphenous vein that ascends upward, okay, along the medial portion of the thigh, okay, and that is actually goes upward, and that makes here, okay, a vein, no. So that vein will be known as your, this is your what? Great saphenous vein. Okay, this is your great saphenous vein. Okay, so this great saphenous vein, it ascends upward and it merges with another large vein. Okay, and that large vein will be, what is that? Medial to the artery. Which artery? Femoral artery. Okay, so here you'll find a vein, right? So this great saphenous vein that actually drains to this great vein. Okay, this vein will be known as your femoral vein. Okay, so this femoral vein that is just, what is that? Medial to the femoral artery. Okay, at the femoral triangle, right? So here you'll find this is your femoral vein. Okay, this is a femoral vein. Okay, so and just lateral to that, lateral to the femoral artery, okay, here you'll find there is a nerve, no. So this nerve will be known as your femoral nerve. Okay, so this femoral nerve that is the anterior division and the posterior division, that will study how they are supplying to each part of the anterior compartment of the thigh. Okay, but for the time being, you just remember lateral to the femoral artery, you will find the femoral nerve over here, right? And just medial to that, medial to the femoral vein, we'll find some other structures. Okay, what is that? Other structures that I will draw in green. So here you'll find some other structures. Okay, so these structures are known as your lymph nodes. Okay, what is that? That is the inguinal lymph nodes. They are known as your inguinal lymph nodes. Okay, so inguinal lymph nodes are here. That means all these structures, they are the contents of the femoral triangle. But here you have to remember one thing, that except the femoral nerve, the femoral artery, the femoral vein, and the, what is that? The inguinal lymph nodes. Okay, they are the they are actually enclosed by a sheath. Okay, that sheath will be known as your, what is that? Femoral sheath. No. So what is this femoral sheath? So femoral sheath is nothing but, here you will see the muscle, right? So this muscle is your what? Iliacus muscle. As I told you that when the pelvic fascia, it covers to the iliacus muscle, it will be named as a fascia iliaca. Okay, that will be known as your fascia. Sorry. Not a. That will be known as your fascia iliaca. Okay, what is that fascia iliaca? Fascia iliaca is the fascia continuation of your pelvic fascia. And what is pelvic fascia? That is nothing but the continuation of your thoracolumbar fascia, right? So all these fascia, they are interrelated to each other, right? So posteriorly you will find what? Here the fascia iliaca. Okay, and anteriorly, you know that you will find the anterior abdominal wall over here. and most inner part of the anterior abdominal wall, that is known as your, what is that? Fascia transversalis. Fascia transversalis. Okay, so anteriorly what will find? Fascia transversalis. Posteriorly what will find? You'll find the fascia iliaca. Okay, so these in between these fascia iliaca and your fascia transversalis, you will find the presence of the artery. Okay, medial to that you will find the vein, femoral vein. Okay, and medial to that you will find the inguinal lymph nodes, right? So all this here. Posteriorly you will find what? The fascia iliaca. Anteriorly you will find what? There is the fascia transversalis. Okay, so it is just adhesive to each other at this point. Okay, but that ends here, no, here at the inguinal ligament only. Okay, but what happens here during the what is that, during the life before you started standing? Okay, up to that, this fascia that is present over here only, just above to the inguinal ligament. But when the baby started standing, okay, at that time this fascia that is just pulled to downward. Okay, when the baby started standing, okay, at that time these two fascia, okay, the circular part that is just pulled downward. Okay, so that means what? Here you will find there is the femoral artery. Okay, here you will find the femoral vein. Okay, and and here you'll find the lymph nodes. So all these three structures, they are just encircled within a funnel shaped sheath. Okay, funnel shaped sheath, and this sheath that is made up of anteriorly by the fascia transversalis and posteriorly by the fascia iliaca. Fine. Now this sheath that is just covering to here, you can see. Okay, it's just covering to the covering to the femoral artery, covering to the femoral vein, and covering to, what is that, your inguinal lymph nodes. Okay, and that just comes downward and ends just 2 to 3 cm below to the lymph nodes, inguinal ligament. So this funnel shape, what is that, facial sheath is known as your femoral sheath. Okay, and within that what you'll find? You'll find the femoral artery, femoral vein, and the inguinal lymph nodes. Okay, and just outside the femoral sheath you will find the femoral nerve. Okay, remember, femoral nerve, that is not the content of the femoral sheath. Fine. Now here what will happen? From this sheath, okay, you will find there is the development of the septa. Okay, so this septa that you can see over here, so this septa that actually divides this femoral what is that, to sheath into three compartments. Okay, one is your lateral compartment. Okay, this one will be the lateral compartment, this one will be the intermediate compartment, and this one will be the medial compartment. So this three compartment is made up of when the septa that develops and connects from anterior to posterior. Okay, so it is the three compartments. Within that you will find all these structures. Most laterally the femoral artery, intermediate femoral vein, and most medially you will find the inguinal lymph nodes. That means this area, okay, this area, actually this canal, or you can say this part of the compartment, okay, this compartment, it remains vacant. Okay, only some lymph nodes are present. Why this is? Because when the caval tension will increase. Okay, means inferior vena cava, okay, tension will increase. Okay, at that time these what is that, the caval blood that will engulfed, okay, that will be engulfed inside this, what is that, femoral vein. So the femoral vein should expand, no, to avoid the rupture of this femoral vein. Okay, that's why when the femoral vein will enlarge or engulf, or it will be just stretched out, at that time there should be the vacant position. Okay, otherwise this femoral vein that will be bursted, no, that will be ruptured, no, if any solid structures will be present at the medial compartment of the femoral sheath. So now this
Yes, sir.
femoral vein, when the caval tension will increase or the portal hypertension will be there, portal hypertension will increase, at that time what will happen, this vein it will be enlarged. At that time there should be some area, vacant area, for the femoral vein. Now for that reason only some lymph nodes are over here, but technically this medial compartment is known as your femoral canal. Okay, this medial compartment is known as your femoral canal. Okay, and the opening of, or the the opening of this femoral canal, this one, right, this is your, what is that, femoral canal. Okay, this is your canal, but this opening or the face of this femoral canal is known as your femoral ring. Okay, so you should know about all these different things. So what we got the femoral ring, right, the opening of the femoral canal, we got the femoral canal. What is that femoral canal? That is nothing but the medial compartment of the femoral sheath. Now we got the femoral sheath, no, that is nothing but the fusion of your fascia iliaca and fascia transversalis, right, and we got the femoral nerve, the femoral artery, the femoral vein, inguinal lymph nodes, no, inguinal ligament, right. So all these structures that is present over here at the femoral triangle. Okay, now we'll see the roof. We have seen the border, we have seen the floor, we have seen the contents of the, what is that, femoral triangle. Then we will see the roof. Okay, roof means what will find, there will find the fascia. Okay, what is that, superficial fascia, deep fascia. Okay, and skin, no, skin, superficial fascia, fat and everything, no. So remember one thing, that at the lower limb the fascia that is actually started from your toe, and that is a socks like structure, no? You know the stockings, no, stockings, the ladies they are using, no, that is from the toe up to the waistline, no, so that stockings like structure, right. So the fascia is nothing but the, what is that, the connective tissue, no, arrangement of network like connective tissue that is in lower limb. It is a stockings or socks like structure that you can wear, that starts from the toe and it ends at the ASIS and at the pubic tubercle level, right. So as you know that when you are using the stockings, you are using the clips, no, to hold that stockings to upward, no, like that. So this fascia when it ascends upward, right, fascia it ascends upward, right, it has some clips laterally, it is just anteriorly and laterally it clips to the ASIS. Okay, posteriorly it clips to the ischial tuberosity. Okay, and medially it clips to the pubic tubercle, right. So this is whole, what is that, you will see, what is that, fascia. Which fascia? This fascia will be known as your, who can say this fascia, the name of the fascia is your fascia lata, fascia lata. Okay, but at the lateral side, okay, you will find that this fascia lata because it ascends upward, no? That means it attaches to the tibia and fibula, it attaches to the ASIS, okay? And due to that, this area that becomes more toughened, okay? And toughened and it attaches to the tibia, part of the fibula, and to the ASIS and your iliac tubercle, no? So this is your tibial tract, no? What is that? IT band, no? Iliotibial tract, right? So this is iliotibial tract that is made up of your, what is that? Fascia lata. It is the lateral part of the thigh. You will not find any muscular compartment, okay? That is only you will find the fascia lata, okay? The modified fascia lata is a iliotibial tract. Why we are calling iliotibial tract? Because it is attaches to the iliac tubercle and ASIS to the lateral condyle of the tibia and some part of the fibula, right? So this is your iliotibial tract that is made up of your fascia lata. Now you see, you just see my drawing direction, my pointer direction, how they are attaching, right? Now it ascends upward, okay? So what they are just attaching to the ASIS, okay? In this way all they are attaching, right? And the lower part of the fibers, just see. Oh, I'll take another color, no, so that it will be clear. See the direction of the fibers, no? They are just attaching here ASIS, okay? In this way, okay? Then it returns back again. See, it returns back, okay? All these fibers, they just returns back, okay? In this way, and attaching again to the pubic tubercle, okay? All these fibers, they are attaching over here, okay? And returns back and attaches again to the pubic tubercle. Now at this point you find a gap over here, okay? How this gap found? Here you see this is your iliac tubercle and the inguinal ligament, you say, okay? So these fibers are just coming in this way, okay? Then in this way, right? Okay, then they again returns back, okay? And attaches to there only, right? In this way, right? Now here you got a opening. All of you are clear about this opening? How this opening forms?
Yes, sir. Yes, sir.
Okay. Now this opening is known as your saphenous opening. This opening is known as your saphenous opening. Okay. And this saphenous opening, why this saphenous opening? Because the great saphenous vein, no, that ascends upward and drains into the femoral vein. Okay. So only the saphenous vein that passes through this saphenous opening and it drains to the femoral vein. But is that opening is in open situation? No. Here what you'll find? You'll find the fats over here and the fascia, fats and soft fascia. Okay, so this fascia, it is very loose fascia. It is made up of your fat and the connective tissue, okay? And this fascia will be known as your cribriform fascia. Okay, what do you mean by cribriform fascia? Cribriform means it is porous, no? Means it is very loose connective tissue, and it is also filled with the fat pads, right? So it is nothing but the saphenous opening, and this saphenous opening, it is filled by the cribriform fascia, okay? And how this saphenous opening forms? Saphenous opening is the deficiency of the fascia lata, okay, at the medial compartment of the thigh, right? Where the great saphenous vein that enters into that and drains to the femoral vein, right? So this is the roof of your femoral triangle. What is the roof? Roof is formed by the fascia lata, the superficial fascia, the cribriform fascia, the skin, and the fat, right? All they makes the, along with the, what is that? Great saphenous vein, okay? That makes the roof of the femoral triangle. Okay, any doubt up to now? Here we have completed the femoral triangle and anterior compartment of the thigh.
Yes, sir. Yes, sir.
So, boundary, all of you are clear? Floor,
Yes, sir.
muscle, or the roof, floor is made up of by the four muscles, no? Okay, so for this reason, you have to remember one mnemonic here, no? What is that? Means this mnemonic is from my side. I don't know. Okay, so you just remember that uh, sail the navy, okay, and drink the appy. Okay, it is my mnemonic. Okay, so sail represents your borders, appy represents your floor, navy represents your structures, contents, contents better. Okay, so what is this? S. S for sartorius, A for adductor longus, IL for inguinal ligament. Right. So these three things makes the border of the femoral triangle. Okay. From lateral to medial, what the structures are present? N for nerve. Which nerve? Femoral nerve. A for artery. Which artery? Femoral artery. V for vein. Femoral vein. Y represents your lymph nodes, because in this Y fashion the lymph nodes are present. Right. So in this way, right? So most laterally femoral nerve, most medially most laterally femoral nerve, medial to that femoral artery, medial to that femoral vein, and medial to that the lymph nodes. What is appy? Appy represents your floor. Okay, from medial to lateral, what will find? A for adductor longus, P for pectineus, P for psoas, I for iliacus. No, so that it will be easy to remember about the floor of the femoral triangle. Okay. So if you see the clinical part, because why this femoral triangle we are studying? Okay, because if you'll see the femoral triangle, okay, and the femoral canal, no, here we got the femoral canal, no. So this femoral canal, that is actually very clinically important. It is very vulnerable, and it is a weak point, okay, at the anterior abdominal wall. Okay, why that? I'll take some other class, okay, because you may have some other time. Here the femoral canal, no, that is for the femoral hernia, because the abdominal content, though that is the gap and there is no other contents, that's why what will happen, the femoral the abdominal content, the small intestine, the loop of intestine, that may enter to the, what is that, the femoral canal, and that may protrude out over here. Okay, over here. So that will cause the femoral hernia. Okay, and this femoral hernia is more common in female. Okay, why? Inguinal hernia is more common in male, but the femoral hernia is more common in female. Why? Because of the wider pelvis. Okay, how it is possible, that I will show you in our next class. Okay. And always you remember that this femoral hernia, that is a lump, no, that is just inferolateral to the pubic tubercle, inferolateral to the pubic tubercle. But the inguinal hernia, that is always inferomedial to the pubic tubercle, because pubic tubercle is the landmark, no, you can palpate that. If you palpate any hernia just lateral to the pubic tubercle, then it should be femoral hernia. Medial to that, inguinal hernia. Okay, so it occurs more commonly in women. Okay, because of the wider female pelvis. Okay, the tight boundaries that we'll find over here, okay, of the femoral canal and the femoral triangle, that makes the femoral hernia particularly mainly the strangulation will occur. Strangulation means what? If the loop of intestine will enter into that and that will be twisted, no, and that will be stocked over there, then that cannot be returned back. No, that will cause more severe pain and injury to the small intestine. No, that is known as strangulation. Okay, so if the strangulation will occur, then it is very urgently you have to what is that? Do the surgery. Okay, otherwise manually also if it is not strangulated, manually you can help the patient to take inside by doing some exercises and by applying the hernial belt that no all of you know about that thing, right? Clear everyone?